that are tested work very closely off of these size cuffs. So it's really important to use the right size cuff for the right arm to make sure you're getting the most accurate reading. What will happen if you don't put the right size cuff on as well, on the right size arm, regardless of accuracy, it could reinflate. So that's going to cause a lot more pressure onto your, are they your clients or residents? Clients to your clients here as well too. And when it reinflates, it squeezes to a pressure preset of 160. It's just unnecessary squeezing. So I'm all about better client outcomes. Hi there.
Hello.
I'm Dave.
Sorry for joining you later.
That's okay. I literally just started, so not a problem. These cuffs are reusable. They're latex free. For reduction of cross-contamination, the best is a cavi wipe situation. So just take a cavi if you've got any sort of, if you've got an influenza breakout or what have you, a lot of sweating and so forth, just give it a cavi wipe. These come with a 3-year warranty as well too. So as you buy Virox cavi wipes, over time the Velcro is probably going to lift and you're not going to get that nice adhesion. Let me know, let Neelam know for anybody to contact us, and we'll just replace them. So when you're starting to see that they're not sticking, please let us know if it happens before the 3-year mark. And we're not dead set on the 3-year mark because this is being filmed. If it's 3 years in a few months, it's not a big deal, right? Absolutely.
Could we state the date?
Today's date is, yeah, there's little timestamps on here too, just so you know when they were manufactured. Just because they're manufactured on a certain date doesn't mean the date they arrived here. So we'd work with you on that. So as we say at Well Challenge, a cuff is a cuff is a cuff. Because it's just the raw cuff, you can go onto left arm. If you rather be onto the right arm, you can. This port, as long as it's on the outside, you're good to go because then you can just snap into. So some of you being clinicians, you don't need to adjust it at this site. You don't need to even go there to switch the cuffs. They literally just snap in as such. You want to hear that snap? It's really sweet. So it's quick and efficient to change cuff sizes quickly.
And to remove?
Remove, tug the elephant ears here, just push in. And then when you're doing it the other way, I usually do an index finger, so you want to hear a nice snap in there. And then release, switch cuff sizes for a little bit of a smaller resident, client of yours, and so forth, right? So just to switch the cuff sizes. For emaciated, some of your smaller ones might be a size 9, Emmy, possibly. This is a size 10. Make it pretty clear how the cuff sizes work. We mark what number it is here. It's always highlighted which cuff it is. It says 10 again here, and we make it easy by color coding. So you know this is the small adult, the dark blue is the regular adult, and then you've got your large being the burgundy. So it's burgundy, blue, light blue, and then there's a green for the small. It says child, but that would work for somebody who's 90 pounds-ish maybe and under, maybe 100 pounds and under. But again, it all depends on, so this is the most important part in selecting the right size cuff. We've made it really easy to line up the brachial artery marker with the brachial artery. And as you come around, there's a range on the inside of the cuff here. And when I flip the cuff around, you'll see the same range marker on the outside of the cuff here. Mm-hmm. So you want to ensure with these that you're in this range somewhere. That's really, really important that you understand that, again, to make sure that this is giving you the best outcome. If you're outside the range here, you're going to want to bump down a size. Conversely, if you're outside the range here, you're going to want to move up a size. So, does that make sense?
Yes.
Yeah. Best practice, of course, always on the skin. You probably already know that. If not, the algorithms in this are fighting through even a light.
It's good to have this on tape because a lot of our staff will think it's okay to put it over clothing, and I'm like, it doesn't matter.
It's really not. I'm not a clinician. It's really up to you how you want to engage with your clients here, but best practice definitely on skin, for sure. Yeah. And again, cavi wipe if there's any, just to keep them, because they can gum up pretty quickly, right? Especially if clients are sweating and so forth. So that's cuffing. So once you've got the right size cuff on patient arm, and of course I'm doing it over my sweater, I'll talk to you about the device. So the stand is coming for some of you that joined a bit late. There's a mobile stand for this. This right now says Z. It's gone to sleep. It'll sleep after 90 seconds of no activity. So it's just in its sleep mode. To wake it up, just press the power button once. You have to give it a good push. Probably because it's still charging up. So once it's woken up, that says Fahrenheit. I'll change it after the in-service to Celsius. I'm assuming We're all Celsius here. You prefer Celsius. So when you take a blood pressure, the buttons here are your power button, on and off. You can actually shut it right down if you like by pressing and holding. Again, it'll go to sleep after 90 seconds. You can press any button just to start it up. To take a blood pressure, once the cuff is on, you'll touch the blood pressure button there, which is right here. The MMHG button is probably your best friend. You know your clients here most intimately. So if you know that Mr. Jones here is a 110 over 70, for example, I'm just using an example, this pressure preset is set to 160. So there's no point in squeezing Mr. Jones to 160 if you know that he or she has a lower blood pressure. So what this button allows you to do, if you push and hold this button, 160, you can toggle through 140, 120 is the lowest you can go. So 120, I would pressure preset it so it's not squeezing unnecessarily all the way up to 160. Again, you're going to get a better client outcome because it'll only go as high as 120. If it needs to go higher, it'll repump again, but it'll only be a good for one time, which is really nice. So once you hit the go button, it'll take that one reading, it'll default back to 160 after the one reading. Does that make sense? Mm-hmm. Yeah. So conversely, if you've got someone that's maybe a little bit higher than 160, you can go up to 200. So I'm just toggling through the difference so you can see. So it's 120, 200, 180, and down, and so forth. So just leave it for 2 seconds, and it's good to go. Press start, it'll do 200, and away it goes. So again, that's your MMHG button. So the only buttons you're really going to power on and off, take a blood pressure, and if you want to use this button, you can push and hold. And if you don't touch it within time, it'll time out like that. So push and hold, wait till it appears, and then toggle through to your desired pressure preset. Most of the time, standard 160. That's why it defaults to 160, the computer in here. But again, if you want to change it, you really will get better outcomes. I know Emmy will call me, hey Dave, you know, a lot of the folks on the ground are saying it's squeezing too much. If it is, just feel free to use this button and bring it down to maybe 140 or 120 if you need to. Thermometry. Pull up the temperature. You're going to wait for the 2 beeps here. That lets you know it's ready. It's an ambient temperature mode. Your probes I've put in here. Neelam, have you ordered additional probe covers? You'll probably go through these pretty quickly depending on how often you're taking
I think we have.
vitals.
Yeah, I think you have them.
Are they the same ones for the
Yeah,
handheld ones? I was just going to ask you that.
Perfect, they are.
Yeah.
Absolutely.
Yeah.
So if you've got those stocked, well-challenged, no problem. So you've all used the handheld probe covers, same thing. Push down into this blue will pop up. Now you know that you have the probe on once it's sticking up as such. Probe covers on, and then sublingual pocket.
Quick.
Again, that's Fahrenheit. To eject, if there's a garbage, just push the button and it'll eject the.
Is this? Yeah, those are a different brand.
Perfect. No,
Are
that's
they a different brand? This is Cat Fusion.
no, that's perfect. That's well done.
Same?
Yep.
These?
Oh, sorry. The probe covers. I've never seen these. Yeah.
Me either.
No, those won't work with this.
Okay.
Oh, yeah.
Won't work. Oh, they won't? Okay.
different size.
Also.
Di-
Oh, they
yeah.
don't work for these ones.
Yeah. Oh, okay.
Yeah.
So I know that you do the other ones.
So whatever we use for these ones, it'll work for that one. Okay.
And this machine here is like a new one, so these aren't working.
Those probe covers are from our old well
Those
to in
are-
my
this-
back.
That's a well.
Yeah, those probe covers are
Sorry,
super. You can- yeah. So, just the Welch-Allyn branded probe covers for the Welch-Allyn devices. Just make sure it's the green top. It actually says Welch-Allyn on there. Try and get in the habit of releasing. I've seen sometimes when you put we're all human, we make errors of course, but the probe cover goes back down into the well. It'll get stuck in there and then you may have to sort of try and get a pin to fish it out.
We just call you.
Just call me, yeah, exactly. So you have your temperature of course, and then pulse oximetry of course would be on the opposite hand to the opposite arm to where the blood pressure cuff would be, so we're not loading that side.
So it doesn't, when it does blood pressure, it doesn't automatically do the pulse?
No, pulse ox different than the blood pressure. Yeah. I can take a blood pressure on me, but over the sweater it'll be a little bit challenging. So there you go. So this is, as the machine says, it's a spot check. So it's basically, you know, all at once, pulse ox on, my cuff could be on, I hit start, thermometry in the mouth, you're probably 30 seconds or so to have all the vitals captured. So that's that. So you've got your vitals, not including the blood pressure, of course. So it takes the 3 parameters: the temperature, the pulse as well, pulse oximetry. What do you do with that? Do you manually chart are you using an EMR in this space? Do you chart it electronically then into a?
No, it's manually.
Manually, just into so by client name, date,
Chart, yeah.
and chart.
There are
Okay.
2 ways. We do it for every client who's under 48 hours, and then we do it for certain medications that require a baseline for a.
Gotcha. Okay. So manually charting. So I guess if you know that this is Mr. Jones's vital signs, you're charting, and away you go. The C stands for clear. So if you want to press and hold clear, it wipes the screen, and you're ready to go for your next client.
Is there a memory for past?
There is not.
Okay.
Great question, though. I'm glad you brought that up. So, pretending that the vitals were still here, I'll just take a vital. Remember the 90 seconds I mentioned earlier when it goes to sleep after 90 seconds? If you're in a situation, which I'm sure you are at times, where you're starting to take pulse, maybe you've got the blood pressure cuff on, you're just about to take blood pressure, and I'll just make sure a vital comes up here. And you get a phone call. It's an acute situation. You've got to run down the hall and deal with something else. Sorry, I just want to make sure that this vital comes up here. It will stay on the screen until such time as you come and clear it. So even though the screen goes blank and you have the Z's across it and it's gone to sleep, they'll always be there until such time as you wake it up from its snooze and actually hit the clear.
Okay,
Or until
that's
such time as you've turned it off. Once you've turned it off, there's no memory with this. There was a different monitor that I talked to Neelam about that has memory. You can actually plunk in patient names and so forth as well too, or client names rather. But it's significantly more expensive on the capital budget. So, but that monitor is available out there. So for example, I've got the pulse ox going. I was just about to take blood pressure, maybe thermometry, but I got called. I have to leave. It'll stay on the device until such time as I come back. So 90 seconds from now, the screen will go blank. You'll see Z's across the top. I usually actually just press the clear button once. I just touch it to wake it up, as opposed to pushing and holding wipes it clear. Does that make sense? Okay. The mode button you'll never need. That goes into the back-end computer when you push the power button at the same time. I'll make sure your date and time in Celsius once. I don't want to absorb your time here to do that. So I'll make sure all your back-end settings are right. So again, power button to take a blood pressure. It's the little picture of the arm, of course, with a blood pressure cuff. C, just touching it like that will wake the device up if it's sleeping. Push and hold the C to wipe it clear to go on to the next client. And then the MMHG button, millimeters of mercury, press and hold if you want to toggle through different pressure presets to create better outcomes for your residents. And again, that's a one-time only, so once I press the button, it'll always default back to 160. The most important thing, just to reiterate again, is selecting the right size cuff and making sure that you're in this range here, somewhere within the perpendicular line here on the cuffs. It's super, super, super important. Questions for me? Do you have any?
Actually, I was gonna ask you if you can touch base on, the other cuffs, like in case there's an outbreak.
Absolutely, we would be happy to. Have you experienced outbreaks here?
Yeah,
From
once.
time to time, yeah. So there's a cuff that's called the Eco Cuff without a long ensemble. It's essentially it's a single-use cuff. It's a disposable cuff. We call it Eco because it's made from recyclable materials. So when it goes into the waste stream, it's less impact and yada yada. The main thing is that it can be applied to one of your client's arms in the event of an outbreak, or for everybody here, so they all get designated their own cuff. You can take a black felt marker, Mr. Jones, that's designated for Mr. Jones until such time as the outbreak's been contained. And then you can take the cuff off, dispose of it, and re-enter these ones. So this would be my workflow. I see a lot